What's the worst thing you've seen as a doctor? This is part 4, Pediatric Simulation. I was working as a junior doctor in an emergency department. The senior staff decided to run a simulation. This is where we play pretend to see if we can build on our clinical skills and team working ability. They asked me to be team leader of the scenario. The brief is simple. We get a phone call from the paramedics. They're 5 minutes away and they have a child who's unwell. There's a way of running these resuscitation scenarios. Someone does what's called an A to E. A for airway, B for breathing, C for cardiovascular. It's a way of prioritizing what we can do to improve the patient's condition. 5 minutes flies by and in comes the patient. It's a doll brought in by one of the senior staff members who's pretending to be a distressed mother. Now, I won't go through the ins and outs of this whole scenario, but it was stressful. The senior staff member is really playing the part. We have to de-escalate, trying to get access while someone is doing their A to E. We've got one of the staff members playing with the monitor. There's a beeping and it's going fast. Then they're yelling, we've got a low blood pressure. There's lots of information flying in and I'm stood at the tail end of the bed trying to have oversight. Now keep in mind, I'd only been in Australia like a year and a half. I wasn't used to being a team leader in a resuscitation, especially for a pediatric case. I was really stressed. We were going through the situation, but numbers just kept getting worse. And sure enough, that's because this is a simulation. We wouldn't learn much if it all just went swimmingly. But we're getting to the point that the oxygenation is getting lower, their heart rate's getting higher, their blood pressure isn't improving. It genuinely feels like there's a sick child in front of me and they're getting closer and closer to dying. The scenario is eventually called to a close. At that point, we pause, everyone takes a breath, and then we debrief. We talk about what went well, what went poorly, what we could have done differently. And I feel overwhelmed, genuinely horribly stressed. I couldn't help but feel like I had just let a child almost die. And I had to take a moment. I walked outside of the department, and when I came back in, I spoke to my boss. I felt like I did a really bad job. How can I do better? Because if this ever happens and is real, I don't want to go through what we just did. I don't want to feel incompetent and fail some unwell child and their family. Now, it feels really dumb to be so affected by what was make-believe, playing pretend. But the thing is, that situation happened. If we don't get it right, patients can get really unwell and patients can die. And the thought of being the cause of a child dying and a family losing that child is horrific. Which is probably why I'm still working in emergency, why I'm motivated to be a good emergency doctor. But I tell you, make believe or not, that scenario really stuck with me.